Welcome to the Regen Doc Podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. Frozen shoulder, what your doctor isn't telling you. One day you couldn't reach behind your back to tuck in your shirt. Then you couldn't reach overhead. Then you woke up at 2 a.m. with your shoulder throbbing for no reason. And your doctor told you that frozen shoulder, it'll take 12 to 18 months. And there's nothing we can really do. I want to challenge that timeline. Let's get into it.
My doctor says I just have to wait out frozen shoulder. Is there really nothing that speeds it up?
False. Absolutely false. There's a huge gap here. People are searching for frozen shoulder. How long? Frozen shoulder won't go away. First of all, it's adhesive capsulitis, right? We're professionals in the office. It's adhesive capsulitis. So I tell my students, they got to call it by that. But for the sake of the pod, we'll call it frozen shoulder. Here's the challenge with this. People that see this on the front end don't know what to do. So then they just say, it's going to take some time. The weighted out approach comes from this era of old school, archaic way of thinking of how to take care of things. This is before we had options or even knew how to use these options properly to tackle them. So frozen shoulder isn't just stiffness. It is this fibrotic process where that capsule shrinks down, and it's a lot of times because you get injured, then you start babying your shoulder and not moving it as much, and then you can't move it because the capsule starts to get thickened, and then it starts to shrink down on you a little bit and restrict your motion. 12 to 18 months is a monster time to lose without being able to use your shoulder. To me, that's not an acceptable answer. Just deal with it. And imagine if this is your dominant shoulder. If you're right-handed and it's your right shoulder, or you're left-handed and it's your left shoulder, imagine the everyday impact that makes on you. Brushing your teeth, going to the bathroom, cooking, whatever, driving. And if there's a way to buy back time, wouldn't you want to do that versus waiting it out? So I think that's the knowledge gap here a little bit, is that there are things that can be done. And what are the components? Why did somebody get it? And I think that's the other piece to it, is trying to figure out, why did somebody get it?
Should I be forcing my shoulder to move or stretching through the pain?
No. I think when you get to that point, you need some help. Certainly PT can help you. But if you're not getting better in that 3 to 6 week mark, then I don't think more PT is the answer. I can't tell you how many times we see people that'll come in and they'll be like, I've been in PT for months and I'm not really all that much better. And to that I go, what are you doing in PT for that long? Why are we keeping people in PT for months when there are clearly better options to help aid that PT, right? I'm not hating on PT. I'm just thinking, why are we keeping them in PT for an inordinate amount of time? I tell people in our clinic all the time, I don't want you in here all the time. I want you out. We love seeing you. We love our patients, but get out. Go do the things that you want to do. I don't want you in here all the time. And so that's part of trying to, I think what people get wrong a lot is that aggressive, when you get to that point, you're kind of like, now I'm stuck, right? And so that's where I really don't think that that's going to help. There's a procedure, it's called an MUA, manipulation under anesthesia. So if you get to this point, one option is they put you under general anesthesia and then just crank on your shoulder until that capsule pops. You can imagine there's some downside risk to that, right? And so it gets to a point where you don't necessarily need to have that. There are a lot of other non-surgical options, non-general anesthesia options that can have you moving your shoulder pretty quickly in that same office visit. So that's one of the things. So imagine this inflamed type of irritated, thickened capsule, and then you're actually looking at how do I take care of the issue, and what you're really trying to target is some of that chronic inflammation that's there, that bad inflammation, and actually introducing better inflammation, good blood flow, good cells migrating to that area, and getting that movement. A lot of times when we talk about this, it's about those little gentle small movements and building blocks rather than those big massive strides that everybody's trying to get through, and sort of doing the same thing with the pulleys and some of these like spider crawls on the wall and all that stuff. And I think there's a time and a place for it. Much like everything that we talked about, there's a time and a place. But if you keep doing the same thing over and over again with minimal results, versus they're coming to our office and they're like, I can't believe that I can move my arm like this. And then you start to see and start to understand why we're cutting injury time and downtime in a lot of cases by 50% or even more. So I think it's having an understanding of what you're trying to tackle. So the big thing here is if any of this stuff and you're like, I wish I could read more about frozen shoulder, or I've heard this term adhesive capsulitis, I would tell you to go to dynamicathlete.com, read about some of the issues that we can solve from a non-surgical, non-general anesthesia, non-PT standpoint that can actually accelerate your healing. So once we get you moving, and then how do we get you stronger? And I think that's where PT has a role. And so that's where I think get yourself educated, go to dynamicathlete.com, read about it, and then really be informed and see how that can make a difference in terms of what the other options are.
What can actually shorten the frozen shoulder timeline?
Yeah, I mean, here, I'll tell you, steroids is not the answer here either. So we get a lot of people that'll say, I've had a steroid injection, I've had PT and it didn't work. Therefore, please don't get a steroid injection and think that that's going to solve the problem here, because generally speaking, they put the steroid into the joint. So what does it do? We've talked about this before, where steroid injections are chondral toxic, so damaging to the bone, toxic to the bone, where there's no reason to it. This is not an in the joint problem. This is a capsular, out of the joint problem. So injecting steroids isn't the play here. I'd rather somebody just inject saline into the capsule and try and pop it that way and try and help going that way. And we've done that, and that can help in certain situations. That's not our go-to. That's not our first. That's not our preferred way, because they're, obviously from that standpoint. But if you're looking at this, I really think that the EMTT and focus Shockwave here is an absolute game changer in the world of frozen shoulder or adhesive capsulitis. There's certainly a nerve component that plays a role into it. There's also, we've talked to colleagues, I've talked to colleagues about the nervous system and how that can play into a role of frozen shoulder. So imagine you're dealing with this shoulder and you're really nervous about what's going on. It hurts every time you move, and then you start to get a really activated nervous system. And so that's something to sort of consider. But yeah, I mean, I think the increase of good inflammation with the focus Shockwave, working on the nerve component and really settling that down and creating a better healing environment. And then even the use of PRP in some instances can make a difference. But certainly those two, the first two things, are the big thing that I think would actually matter. And you're able to shorten those timelines. I mean, imagine getting back in 6 weeks, 3 to 6 weeks, where you're like, wow, I'm now able to move my shoulder, and now I can go into PT and get stronger. We've now bought back over a year, if you're looking somewhere between up to 18 months. you're buying back time when you make the right decisions on how you tackle these things. You are just delaying and continuing your pain cycle when you keep doing the same things over and over again.
Have you actually shortened someone's frozen shoulder recovery?
This is one of my favorite topics because we have a lot of patients that I can give you examples on. I'll give you two. The first one is a woman who came in post radiation treatment for breast cancer. Pretty well known complication is fibrosis post radiation. So what have we been talking about? It's the capsular fibrosis. It's you get a little bit of fibrotic tissue in your pec. She can't move her arm past her shoulder. So visualize this. She's trying to lift her hand, a straight arm, above, and she can only go to 90 degrees. If that. I don't even think she got to 90 degrees. So we started doing some work with her, and we used EMTT, we used the focus shockwave, we used the radial pressure waves. We're working on her capsule, we're working on her pec, and we checked pre and post treatment in terms of her movement and where she's getting some of that restriction. And she's lifting her arm where her elbow is now past her ear. And she had treatment many, many years ago. About 7-8 years ago. So I said, when was the last time your left elbow was past your ear? She said, 7-8 years ago. This is a woman who, as active as she can be, 7-8 years can't get past 90 degrees with her non-dominant shoulder and just dealing with it. Has gone through PT, done everything imaginable, right? This wasn't a couldn't afford issue. This wasn't I didn't want to invest in this issue. She just didn't know. And then had gotten some type of shockwave done elsewhere and thought, well, shockwave doesn't work for me. And it wasn't until she spoke to a physical therapist who we happen to know mutually, and he texted me and asked me and said, hey, have you ever dealt with anything like this? I go, yeah, this is what this is designed for. We can take care of this. We can help her. And now we have a woman who cancer's in remission. She's doing great and can move her arm. That's pretty special. I mean, even like we see this on a day-to-day basis in our clinic, and our group talks about how this never gets old. It's pretty cool to be able to see somebody move their arm in that way, or when they come in and they're restricted and it hampers their life. And then you start to see them sort of walk out. And even our front staff, who they're not back in the rooms with us, they see these people walk in a certain way and then they walk out like a different person. And you can see and you can feel how much everybody's a part of taking care of our patients. So that's one of my favorite cases. Number two, one of my favorite people, it's a good friend of ours, and he comes in with the same issues. He's been having 3 months of shoulder pain, and he's one of the nicest guys you'll ever meet, and he's like family to us. And he's tried everything, same thing, and really for him, it's more about he didn't want to be a bother, and would push through it and try to be one of those guys that can push through anything. I've seen him have a nail through his hand and it's like nothing to him. So you can tell, like, when he complains about something, or I shouldn't even say complain. He just brought it up to me, like, and oh, by the way, and we were doing stuff, at our house, like at my house, and at the end of kind of the work that we were doing, he said, my shoulder's been bugging me, and I said, well, let's go to the office right now. And I think it was 8:30 at night. And I'm like, okay, let's go to the office. I'm going to go get your tree. He's like, no. Like, I don't want to bother you. I said, forget. I said, if you're complaining about this or even mentioning this, it's a problem. So we go there, we do some work, we do some EMTT, we do some Shockwave, the whole thing, right? We do all this stuff. And same thing. He's able to move his shoulder better than he's able to do it in the past 3 months. And so you start to compound this and it starts to make a difference. Now, he's got some other stuff going on. Understandable. That, that's a separate story, but we've talked about this before, that the indicator for how you're going to do prior to an injection or surgery, whatever, is how much you can move beforehand. So the movement is the big thing first, unless there's another reason as to why you can't move it. So you got to get it moving. And so this is the perfect story of somebody that just will push through it. Not a big deal until it's a big deal. And so, and I think, and this is somebody that is like family to us. And even still, so if that person is pushing through it, imagine all of you guys out there that are just like, what do I do here? Who do I go to? And so that's where it can make a big difference.
What should someone with frozen shoulder do right now?
Get some help, right? I mean, that's the thing. In terms of stop forcing that range of motion, if it's not, you're not going to bust your way through it in that sense. So treat the capsule first, restore that motion, and then get after the things that caused it in the first place. So imagine that you hurt your rotator cuff, say, or your bicep tendon, and then you start not using your shoulder as much. And then you start to get this frozen shoulder adhesive capsulitis problem. And now you have to work backwards. You have to take care of that motion first, and that capsule, and then take care of the bicep tendon or the supraspinatus or rotator cuff or whatever have you. So it's sort of like this last one in, first one out type of deal where you have to work backwards. So that's one thing. And then if you're going to see somebody and they say, well, let's do a steroid injection, have you go to PT, and I would say, wait a minute. This is where I would say, walk out, go get another opinion. But I would ask and say, look, are there any other interventions that can be done that can shorten this? Because I heard on the Regen Doc podcast that there are other things that can shorten this time frame up. Are you aware of that? And if they're not, walk out, go get another opinion. I think losing a year of your life or compromising your situation for something that can be handled and treated and accelerated is way too long and shouldn't be accepted anymore. Things that would take months or over a year, and now we're taking care of them in weeks. We're talking about weeks now. I'm not talking about months. I'm not talking about practice like Allen Iverson. I'm talking about weeks. We're taking care of things in a much faster timeline. And so that's why I don't think those are acceptable answers, at least not in our clinic. So the big thing for me is frozen shoulder isn't just about stiffness. It is a fibrotic process of the capsule with stagnant inflammation, really, where the steroid injection isn't the play here. You're actually trying to take care of that fibrotic process and actually increase blood flow to that area to help that get going. Aggressive treatments of stretching aren't going to be the answer here. So 3 to 6 weeks in PT, either you're getting better or you're not getting better. If you're not getting better, get out, because we don't want to waste time. And I think if you look at it from a regenerative medicine standpoint, you can drastically change your timeline outcome from months/year, year and a half, whatever, to weeks. And that's, to me, is why we go after it so hard. We're buying back time. We're buying back months of somebody's painless, pain-free, or significantly diminished pain and restricted range of motion. I gave you 2 examples. One was years and one was months. And there's all comers in between. And if you can shave that down, I don't know why you wouldn't explore it. And I think that's really a big thing. And a lot of this is just coming down to knowledge. So I would encourage you to go to dynamicathlete.com, read up on this stuff, read about what's potentially out there, figure out, listen, if you've had Shockwave done and now you know what Shockwave is, re-examine whether or not you've gotten true Shockwave and whether or not you've gotten what we've talked about, because we make huge strides every time we see somebody in that regard, and you can too. So I think the more that you know, the more that you're informed, the better you're going to be. And certainly our goal, we talk about this all the time, is how do we buy back time? Your most valuable asset. How do we buy that back? And in this particular case, with frozen shoulder, adhesive capsulitis, this is one of many examples where you can buy back time if you go after it in the way that we're talking about it. All right, we'll see you next time.